Hi, my name is Brooke and I will be talking about my poster, which is palliative care for HCAs. The first one that I will be talking about is the definition of palliative care. So palliative care is caring for someone of any age. That could mean that they have heart failure or cancer or something else that is life limiting to them, which as an HCA you'll have to respect them, as they may have different cultures, beliefs, values, so you have to respect them and their family. Showing them kindness, being kind to them, like asking them if they're okay, how are you doing today, speaking in a clear and loudish tone if they can't hear you. Supporting them through their end of life, so if they need like washing or if they need help. So yeah, communicate with them and their family with any new information. So if you get any new information, then you need to tell them straight away, but if they're resting, then also tell the family, because the family needs to stay in the loop and the family may need to know what's going on. So comforting them when they need it the most, caring for them, giving them personal cares, and if they're able to get up and go for a walk outside to get some fresh air, then take them for a little walk. If it's not possible for them to go for a walk, then take them in a wheelchair so they can get some fresh air. Right, the next one. So the next one that I will be talking about is personal-centered care principles. So this would include hospice, because hospice, they care for anyone of any age that have a limited life or someone that is about to pass on. Giving them medication for pain and finding them some activities to do to help them not be so stressed. Making sure or asking that they're okay and how their day is going, so making conversation with them. Letting the family know that there are counselling and other services out there if they need it. So if their loved one has passed on, then they can always get support, so they can get counselling or therapy for them so that they're not going through it alone. The next one that I will be talking about is Te Ara Whakapiri. So that one needs to have a clear tone and clear voice so that the client and family can understand and hear you, which is this one. So equipment is always available to them if they need it, such as a wheelchair or a walker or other equipment that they may need, like a walking stick if they need it. Caring for someone is always important to them and their families. So their family is always there. So you need to be aware of their family and how you treat your patient or client. The next one that I will be talking about is cultural safety and Te Ao Māori perspectives. So Māori people did struggle to get their elderly or someone who had a life-limiting illness into care, mainly because they didn't feel as equal as other people and they didn't feel like they had a lot of rights. They would normally always do self-referrals or specialist referrals so that they could get in. This would take a lot of forms and it would take a while, so their family wasn't getting the correct care that they were hoping to get. Food shouldn't be passed over the head, as it is disrespectful to Māori culture. So body washing has always been done a certain way, which is your head, the genitals, and then the anus. So surfaces for sitting on, as food and medication are always put on them, and you wouldn't really want to be sitting on someone's germs. So the next one I will be talking about is application of person-centered care principles, which I have chosen spiritual. So Mrs. W may have different traditions and beliefs, so I need to accept it and be aware of it. And I also need to respect her during this time, as she does need care.